Hi, this presentation is about workplace bullying by myself, Dee Dee Love, Amber Olson, Priscilla Lazar, and Mary French. The definition of workplace bullying is an ongoing conflict that lasts at least for 6 months. The person would have two negative experiences within a week period. But the key is that it is ongoing and it lasts for a long period of time. It usually involves a power disparity as well. Sometimes that is just someone who has more seniority. Sometimes it's a supervisor or manager. It also differs from lateral violence. Lateral violence may be simply someone losing their temper, maybe having bad people skills, but it's not as consistent and it's not as consistent as workplace bullying. Workplace bullying may also be subtle and non-aggressive. The person may be trying to hide it and appear innocent in front of other people. In a study done by Johnson and Rea, they used a convenience sample of 249 people. Of those 249 people, 27% of the sample were victims of workplace bullying. 50% of those victims were victimized by their managers or direct supervisors. That's staggering. And 41% of the victims said they were bullied by more than one person. There continues to be a problem in many workplaces with workplace bullying. There are several consequences to the facility and the victims for workplace bullying. Some of the consequences include that a victim is twice as likely to quit if they're bullied in the workplace. That's staggering. It's very expensive to train new employees. It also decreases morale, which this also encourages people to quit. When morale is decreased, people will leave. It increases errors. This includes medical errors. Also creates adverse patient outcomes. All of this creates increased expenses for a facility. It's in the facility's best interest to figure out how workplace bullying is happening and figure out how to annihilate it. In the study done by Johnson and Rea, they discovered that there were generally two approaches to eliminating workplace bullying. And of those two approaches, it was interventions towards the individual nurse or interventions towards the nurse leaders. And probably both of these would be the best approach, coming at it from both sides. And in the slides to follow, you're going to find out what type of leadership styles that we could choose from, and then what type of leadership style that we think is probably the best approach to eliminating workplace bullying.
Hi, I'm Amber Olson, and I'll be first going over a quick introduction of the three types of leadership styles and introduce the style that best suits our topic of workplace bullying. The first leadership style is authoritarian. Some characteristics of authoritarian leadership is that they maintain strong control of the group. The group is motivated by coercion, which means that the ideas of the leader are pushed onto the group, and the group is expected to follow that decision. The communication flows downward. There is little to no feedback from the group to the leader, just from the leader to the group, and criticism is punitive. The group is told what is wrong and what needs to be improved upon. Authoritative leadership disregards autonomy. Sometimes an authoritative leader can be resented by the group for this reason because they're unable to contribute and collaborate to help make decisions. The second leadership style is democratic. A democratic leader maintains less control by guiding the group using suggestions rather than demands. In a teamwork setting, this leadership style is ideal because it allows communication flow from the leader to the group and from the group to the leader. This encourages open collaboration amongst each other. You'll also see that this type of leader uses constructive criticism to work through issues rather than pointing the finger or demanding improvements. Democratic leaders, although make the final decision, do so after listening to everyone's opinion on the subject. The last leadership style is laissez-faire. A laissez-faire leader has little control over the group. Appropriately, laissez-faire means to leave alone in French. They do not provide much motivation for the group because they are less involved and give little to no direction. Communication still, however, flows up and down, but the final decision is made by the group, not the leader. Criticism is given through peers rather than the leader. It's something where they can get feedback only when asked for from the group. So after looking at the three leadership styles, a democratic leader seems to be the most fitting for the topic of workplace bullying. In almost any healthcare setting, collaboration and cooperation of the group is necessary for the unit to function. A democratic leader finds a balance between unity, around a sense of common ideals, liberty, and diversity. One of my favorite quotes from Philip Woods is that people need to feel commitment, a sense of direction, and worth to participate in change. As you can see, and I think most people would agree, that this is what a democratic leader signifies.
Hi, my name is Priscilla Lazar. We're going to go over some common bully behaviors. One common bully behavior is overt bullying, and that weapon is usually verbal criticism, intimidation, blaming, ethnic jokes or racial slurs, finding fault, threatening, and physical violence. And an example of overt bullying behavior is your coworker loudly criticizes you in the middle of a nurse's station or in front of others. That's not usually the first time this person has done that. They consistently find fault in everything that you do and appear to enjoy making you upset and cry or appear weaker and incompetent in front of others, physicians, other nurses, or coworkers alike. Some common covert bullying behaviors would be sabotaging or withholding information, excluding others, unfair assignments, undermining you to your detriment, especially if it comes to patients, and downplaying accomplishments. So, an example of covert bullying behavior is maybe a nurse is frequently offering to finish your work at the end of the shift, and because you've had a busy day, and he or she goes out of her way to, make you feel reassured that they love to help and that they would love to trade difficult patients and give you an easy patient. And this happens on a continual basis. But unfortunately, what happens after is that particular person you'll find is gossiping about you or telling other nurses, physicians, personnel, or anyone really who will listen, that they constantly have to clean up your mess and that you can't cut it as a real nurse, and that continues to be a problem. So let's go over some nurse to nurse bullying implications. And one of them, I would say one of the first and foremost highest percentage rate would be the attrition rate, and often that happens because they just can't take it anymore, or there's not strategies to help them increase sick leave, and that's generally because not because they don't want to come to work because they're sick, but genuinely because they just don't like their job, because there's just nothing effectively happening in the unit that's helping or circumventing their situation. There's usually more accidents or incident reports because people have to work under high anxiety, or pressure levels, and not a lot of people can perform under that continually, day in and day out, depending on how bad it is for them. And there's generally low morale or dissatisfaction that's reflected and the complaints and overall complaints from generally could be coworkers, could be anybody really. And then compensation claims and budgetary concerns, they generally skyrocket based on these behaviors, unfortunately. So best practices and solutions. Practical steps to combat bullying. Anyone who is being bullied should be aware of the appropriate action usually to take. And when I talked about this earlier, maintaining a diary and being assertive is one of the ways that you can reiterate the value of keeping a written log of bully incidents so that you actually have something to reference. And it's hard to remember certain things, details, especially when an event happens and you feel anxiety about it. This will help identify the triggers in a bullying episode and recognize situations to avoid and predict when the bully is likely to occur and arrange maybe a witness to be present, because often management won't witness that because they will conceal that from leadership. Plan to rehearse interventions and think about what you're going to say and how you're going to say it. So disclosure, first and foremost, importantly, is the individual should talk about being bullied, just to put it out there and let them know, either a trusted colleague or hopefully their leadership, they have an open door policy where they can go and talk about those things. Apart from reducing feelings of isolation, and this allows the person that's being bullied to begin to identify the circumstances that are happening and where and when and what under circumstances, this is occurring. One of the other things is being assertive and assertive language. That's another technique or best practice or a solution that you can utilize. Being assertive or assertive behavior is standing up for what you believe in your rights, basically, and the rights of others. Developing assertiveness is a conversational style that can help. It does not mean that, someone is shouting or using aggressive behavior. It just communicates accurate and honest, equal bias conversation styles that can be learned over time to help people communicate in a better way. Assertive conversation requires an understanding of the process of assertion and empathy. Assertive communication has three components. The first one is the non-judgmental statement. For example, when you call me stupid in front of patients, etc., that's one example. The emotional consequence, for example, I feel angry when blank or etc. The last but not least is the effect of the behavior on the victim and the service provided. So, for example, because it makes me seem unprofessional and undermines patients' confidence in our ability to care for them, when blank, blank, blank. It's important to recognize those three aspects of the message: the statement of the bullying behavior and how it makes you feel, and the effect of the behavior of the victim on those who interact with the victim. The final part of the assertion message is vital. It makes it clear to the bully that his or her behavior is unacceptable and there's consequences beyond the relationship between the bully and the victim. It affects everybody, the staff, the patients, everyone around them. This process also involves active listening, and some of the skills included in active listening are paraphrasing, exploring open-ended questions, and providing empathetic responses. Paraphrasing skills often involve checking first that you have understood, what the speaker is saying, paraphrasing what the speaker has said before responding. So, for example, you would want to say, "So what I think you're saying is blank," and that could have a significant effect on the interaction with the bully or the bullies. With consistent use, the aggressor or can reassess his or her view and target a complaint on the victim when it's not necessarily warranted. So it also gives the bully a chance to really hear what they're saying and understand deeply or more deeply what they're saying to others. Assertive language skills are a relatively small change in words that are used in a verbal exchange that can have a profound effect on the outcome or the encounter. And simple changes sound easy, but don't sound easy, to master. But assertive language individuals need to practice non-threatening environments, and that can usually help diminish conversations that would normally escalate or have a devastating effect on patient care or the employees around them. People need to be more proactive in developing effective structures and processes to reduce the incidence of workplace bullying and patients and organizations to help mitigate this situation on an ongoing basis. And if it isn't taken care of, it can have direct disastrous effects on people overall. So open-ended questions, lastly, are one of the probably one of the most effective ways for, I would say, a bully or bullies to really hear how they are affecting others. So, one example would be, you've said that you need to be hard on me because I'm new to the team, but how is that helpful? So that doesn't necessarily come at the person aggressively. It just, puts the question in perspective. Like, what is driving your behavior? Help me understand why you feel the need to do this, basically, without saying that and making the person feel combative. But this is basically a proactive way for developing effective structures or effective practices, to help circumvent situations and hopefully, slow down attrition and bring, semblance to a very, very tough situation.
Hi, my name is Mary French, and I'm going to discuss some issues about how nurse managers have a role in preventing bullying. It was found that approximately 1/3 of nurses experience workplace bullying. The World Health Organization describes workplace bullying as not only a public health problem, but also can cause physical and psychological consequences for the victims. This in turn can lead to burnout for nurses, turnover, and even medical errors. As the nurse manager's role, it is important that they distinguish what is bullying and also manage bullying in an effective manner. They must acknowledge and address the bullying and distinguish what is bullying and how it can be handled. They can promote programs and develop policies that create guidelines to address the bullying. They must also foster commitment, participation, trust, and an open discussion and communication for its workers and the managers to discuss workplace bullying. When dealing with workplace bullying, it is important for managers to utilize different management styles based on the characteristics of the bullying. It was found in the readings that nurse managers need to address what constitute as bullying and distinguish the type of bullying that's going on and address it. It was found that there are 3 types of bullying that can occur. One is intrapersonal, and ambiguous. In the interpersonal issues, it's between target and perpetrator, where the target is they are poor at dealing with issues at hand, and they are also unassertive to the target, to the perpetrator. So manager needs to support the efforts made by the target to end the bullying. In the interpersonal issues, it's where the perpetrator, it deals with the characteristics of the perpetrator. It was found that some would say either they're just like that or that's just how the way they are, and the manager would have to address the perpetrator and what's going on. The ambiguous situation was where the managers were uncertain if this was actually bullying taking place, and they were uncertain if it was actually bullying and how severe enough the situation was and if it would be dealt with at all, where sometimes it was found that nothing was done. When managers are able to distinguish the type of bullying that's going on, then they can, it will be easier for them to decide what kind of action will take place and how they will respond to the bullying that's going on. One of the leadership styles in dealing with workplace bullying could be democratic leadership. Democratic leadership is directed through guidance, criticism is constructive, and it can lead to positive nurse outcomes. Upon the reading, it was found that democratic leadership style was important because it promoted workplace commitment. The managers reported that within the democratic approach, they discussed and made decisions with their employees, and they also trusted their employees and they would help them to actually make the decisions with the managers within the workplace. This in turn would lead to a more positive and productive environment to achieve the goals at hand. One study reported that out of 13 nurses, all of the respondents described their leadership style as democratic. Resolution to workplace bullying often requires someone with power within the organization to stop the bullying. The managers must engage in an ongoing dialogue with staff about the bullying. They must provide an open environment for it to be discussed. And then the managers also need to address what constitutes as bullying, what the managers can and cannot do, and what role the staff has in responding to bullying. It was found that the flow of information within an organization has to be maintained. Otherwise, it's difficult to lead others without the proper information. So one of the things would be, appropriate documentation of the bullying going on. The victim should not have to convince managers that they're being bullied. If they do, this can often lead to them feeling victimized, not only by the organization, but also the perpetrator. The managers need to offer support. They also need to have clear definitions of what is acceptable behavior within the workplace, and the managers should always ensure a respectable environment within the workplace. The managers should encourage staff to provide appropriate documentation and not normalize this kind of behavior or make excuses for the problem. Address it fully, have some guidelines and protocols within place, and make sure that it's documented and dealt with as soon as possible. Thank you.